Hey, this is Dr. Troy in Vancouver, the Vancouver chiropractor at Zenaptic Chiropractic. You know, over 22 years of practice, I've had many patients who present being pregnant with a breech baby, and their pediatrician or their naturopath or their midwife might have said, hey, you should try chiropractic. Namely, make sure your chiropractor does the Webster technique. Now, the Webster technique was coined by Dr. Webster in the late 70s, and we call him the pediatric grandfather. So what he found is the baby, instead of going head down into the pelvic bowl, will be face or head up, and we call that a breech presentation. Now, a couple things can happen. The uterine ligament, there's a ligament that hooks to the uterus, to the front of the pelvis here. So if that ligament gets tight, that baby's not going to be able to drop down into the pelvic bowl. The other thing that happens is that sacrum here can get rotated, and so that won't allow the baby's head to drop down as well. So the pelvis gets out of alignment, that ligament gets tight, and so what we have to do is we have to work on that ligament there, and then we also have to adjust the pelvis to get it back in alignment so that that baby can flip and head straight down. Now the key to this is you have to get in within about 2-3 weeks prior to delivering. So the hardest ones to flip are the ones that are about a week away from delivering. We just run out of time on the number of visits that we need. But the key is to get in as soon as you can to see what we can do to get that baby to flip. The last case I had, baby flipped, and it was beautiful. Mom avoided a C-section, which they said, if you don't get this thing flipped, we're going to have to do a C-section. And so we saved her from that, and thank God for chiropractic and the Webster technique. This is Dr. Troy, the Vancouver chiropractor.